On October 30th, the U.S. Centers for Disease Control lifted the cruise ship ban in North America. But just because the no-sail order has expired doesn't mean cruising will resume on November 1st. Instead, the CDC, in cooperation with the U.S. Department of Health and Human Services, is implementing a phased approach to resuming cruise operations in the U.S. We've analyzed the 40-page framework for conditional sailing and initial phase COVID-19 testing requirements for protection of crew. While the expiration of the no-sail order and the creation of this framework is a step in the right direction that cruisers, cruise lines, and crew alike have been waiting for, it doesn't necessarily mean that cruises from the U.S. will return imminently. The requirements are complicated, so we'll do our best to explain and outline what needs to happen in the coming weeks and months for a cruise ship to receive a conditional sailing certificate and cruising to restart in the U.S. Testing, and more testing. Before a cruise line can even consider applying for a conditional sailing certificate for a particular ship, and within 60 days of the framework being issued, cruise lines must obtain samples from 100% of crew members currently on board vessels and submit the samples to an approved laboratory on shore for PCR testing. When results are received from the lab, the cruise line must report them in full to the CDC. Take note, PCR or polymerase chain reaction testing is known as the most accurate and is recommended for people that are not showing symptoms. Currently, the cruise lines in Europe are using rapid antigen tests. Any crew members embarking the ship in the future must receive a PCR test on the day of embarkation that is immediately transported to a lab for testing. Crew embarking the ship must be quarantined for 14 days, and embarking crew who receive a positive test may be subject to additional isolation. Going forward, cruise lines must test every crew member at least weekly and report the results to the CDC. Passenger testing. 100% of passengers and crew must receive rapid result testing at both embarkation and disembarkation. Individuals will not be allowed to board the ship until they receive a negative test result, and those disembarking the ship will not be allowed to continue to their final destination until a negative test result is obtained. During the initial 60 days from the order being issued, cruise lines must develop onboard PCR testing capabilities for symptomatic crew, passengers, and their close contacts. Any positive test from symptomatic individuals on board must be immediately reported to the CDC. Reporting and government approvals. Since earlier this year, cruise ships operating in U.S. waters have been required to submit enhanced data collection reports to the CDC regarding virus conditions on board. For any ships that have not been in U.S. waters from March 14th through October 31st, the cruise line must begin filing EDC reports at least 28 days prior to the ship re-entering U.S. waters. Port and public health agreements. Prior to applying for a conditional sailing certificate, the cruise line must have agreements with and approvals from port and local health authorities in the U.S. ports where the ship intends to dock, including medical care agreements between the cruise line and local healthcare entities to ensure onshore hospitals will accept any passengers and crew who are evacuated from the ship in need of care. Housing agreements between the cruise line and onshore facilities for isolation positive cases and their close contacts, and an agreement with the local port authority to determine the number of ships that can be safely accommodated in port on any given day to prevent overtaxing local public health resources. Operational requirements. The cruise line must apply at least 30 days in advance to operate at least one simulated voyage for each ship, demonstrating the ability to mitigate the risk of the virus on board. Passenger requirements for the simulated voyage include passengers must consent to participate voluntarily and not as a condition of employment or future compensation. Passengers must be over the age of 18 and be notified in advance that they are participating in a simulation of unproven and untested health and safety protocols, and that cruising during a pandemic is an inherently risky activity. Passengers must have written certification from a healthcare provider that they don't have a pre-existing condition that puts the individual at high risk for virus complications. And passengers must submit to a monitored observation period and lab testing prior to embarkation. The simulated voyage must include embarkation and disembarkation, including terminal check-in, onboard activities, including dining and entertainment, private island shore excursions, if any are planned during future voyages, evacuation procedures, a simulated transfer of positive or symptomatic passengers or crew from cabins to isolation rooms, and quarantine of all remaining passengers and non-essential crew. Pre-cruise notifications for guests. Cruises over 7 days may not be operated or offered. The cruise line website and other marketing materials must notify passengers prior to accepting reservations of any CDC travel warnings, advisories, or recommendations relating to cruise travel, plus a notification that if a threshold of the virus is detected on board the cruise ship during a voyage, the cruise will be ended immediately, the ship returned to the port of embarkation, and onward travel, including their return home, may be restricted or delayed. Standards for hand hygiene, face coverings, social distancing, and ship sanitation must be maintained throughout the voyage. Surprisingly, no specific capacity restrictions or other onboard operating requirements were spelled out in this framework. The worst-case scenario. If a certain threshold of cases is reached on board a ship, the line must be ready to take action. The line must notify passengers, crew members, and government authorities. The line must end the voyage, return the ship to the port of embarkation, and cancel future voyages on the ship. They must also isolate sick or infected passengers and crew in single occupancy cabins and quarantine all remaining passengers and non-essential crew. And lastly, the line must disembark and evacuate passengers in accordance with the local health system and housing agreements, using only non-commercial transportation, and ensure any transportation entities involved are aware of the presence of the virus aboard the ship. Additionally, virtually every element of the framework and these requirements can be changed or amended at any time by the CDC as conditions warrant. In conclusion, this framework is complex, and the time frame for the CDC to approve an application for a conditional sailing certificate is unclear. It's possible that the cruise lines have received some preliminary guidance from the CDC prior to the public release of this framework, and some of the work could already be in progress. While there is certainly a long road ahead for cruise lines to return to service, it's not impossible. It's a matter of satisfying the CDC's requirements. While there will be some hurdles and costs to get ships sailing again, the reward at the end is being able to take revenue cruises and start paying off the massive amounts of debt the lines took to weather the financial blow of 2020. The looming question: how long until cruise lines can actually sail with passengers again? You can find a comprehensive breakdown of the CDC's conditional sail order at cruiseradio.net. And be sure to subscribe to the channel for accurate and dependable cruise news and ship tours.